makes Elk City a place that we needed to come to. There are no Sooner Care providing dentists in this area. And in fact, the closest Sooner Care providers are so full with all of the patients that they have anyway, they're not able to take kids who are coming from this part of the state. And so there is no resource for so many of the children who are in this county. And so Elk City schools have said, let's come out here, let's see what we can do to bring the resources, and that's exactly what our mobile clinics were designed for.
My name is Lindsay Marks, and I am the school nurse for Elk City Schools. Well, each year we screen some of our students for just to look at their teeth and just do a little dental screening with the help of Western Technology Center and some of our local dentists. And we realized that we had a pretty big need for some of our kids to see a dentist and follow up, but we don't have any dentists in Elk City that accept Sooner Care.
As we saw 31 children yesterday to be screening them. The level of need for these kids is tremendous. The nurses were not wrong. They told us the need was high. They knew that there were kids who were missing school because they had significant oral health needs, and that's exactly what we're finding.
We have a large majority of our children that are on either Sooner Care insurance or they're uninsured, and dental care is very expensive, as you know. And so what happens is they just don't get to see a dentist.
So that's why we're here, able to help kids, make sure we're taking care of those who have Sooner Care needs but no ability to access those care.
Almost 2,200 kids in our district.
Wow. And so what, if you were to guess, what would you think are the total number of kids who really have some dental needs that if we could come out here as many times as we possibly could, we would be able to see?
I would think probably at least a fourth of them, maybe half of them, probably 1,000 kids that we could see easily every year. We have several kids that maybe are in pain often, or if their teeth are hurting or get infected, then they end up staying home from school because they're not feeling well, or they're not able to focus on their schoolwork because their teeth are hurting so badly. So it just creates more problems for them going forward as they grow up. Yeah, this has made a huge difference for some of our kids. We've been able to see 45 of our kids through this clinic just this one time that they've come out here. And of those, over 30 of them have needed some type of treatment that they've been able to get right here. So it's for those 30 kids, it's making a world of difference.
Fantastic. Thanks, Lindsay, for having us come out. We appreciate your time and all the work that you've done to get all of these students lined up, get the permission slips. Lindsay has even gone to people's homes to make sure that permission slips are signed. And when you talk about someone who's caring about all of those children in the Elk City schools, Lindsay sounds like an incredible example, and we really appreciate all the work that you're doing on their behalf. Thank you very much. Hi, it's John Wilgus again for MobileSmiles and the Oklahoma Dental Foundation. Here we are being able to help dozens of veterans and their families to make sure that they're getting the basic dental care that they need, and if necessary, be able to move them to an additional dentist at the University of Oklahoma College of Dentistry or at a private dentist. So all of this put together allows us to more holistically care for those in need, to care for those who are otherwise unable to access dental care in a convenient way, and puts us at a place where we're intersecting them as they lead their daily lives. We are so pleased, and all of the great things that they do to help veterans all around the United States. I'm John Wilgus. I serve as the Executive Director of the Oklahoma Dental Foundation. Thank you for being here today. We are so thankful for your attendance as we unveil our newest MobileSmiles Dental Clinic. The Oklahoma Dental Foundation is unveiling today our very first of 5 new mobile dental clinics. The MobileSmiles clinics were purchased with $5.1 million from the American Rescue Plan Act funds that were awarded to us in 2023. These state-of-the-art dental facilities will be ultimately living in geographical spaces across Oklahoma. One in each quadrant of the state, and this one, our urban one, which will go to serve between Oklahoma City and Tulsa. This will allow us to take direct dental care to those areas of the state which have the most intense dental need. Daily, it takes about $5,000 for us to be able to operate our MobileSmiles clinic. That allows us to take care of the dentist, the dental assistants, all of the supplies, all of the fuel, everything that's necessary to make sure that this can happen. The state of Oklahoma has been very helpful to us over the years by providing us with a direct appropriation, and now we have the ability to also draw on Sooner Care benefits from across the state. In 2023, the MobileSmiles unit visited 146 sites across the state. We served in that time about 1,300 patients. 80%, think about this for just a moment, 80% of those 1,300 patients reported that they had an annual household income of less than $20,000. The total value of benefits that we were able to provide to those patients was in excess of $600,000. So that's an important aspect that we remember. We're trying to make certain that those patients who have needs are not limited to access to care because of geographic reasons, which we're now overcoming, and not because of cost, which we've been working to overcome with charitable donations, with the state funds, and with Sooner Care. And now we're going to be able to provide 5 times that amount as each of these clinics rolls off the assembly line over the rest of this year. This would not have been possible without the support of our legislators who thoughtfully, and through the work of the 929 Strategies company, as well as Melissa Houston, who's here today as well. We appreciate that. They thoughtfully allocated the pandemic relief funds for this project and saw how we might be able to make this work.